my name is Cindy Tatiana Jimenez Alvarez. My topic about is fungal endophthalmitis. Definition. Fungal endophthalmitis is a particularly serious complication that poses a significant blindness, typically present in an age with little anterior inflammatory region, but which progress parents or within inflicting in the anterior vitreous cavity in the form of a string or pellet. Might occur of exogenous or endogenous infection.
I would like to talk on endophthalmitis, and it is rare but sight-threatening, can cause blindness in people. And endophthalmitis is defined as inflammation of intraocular cavities and mostly caused by microorganisms. But it's also associated with toxic agent, non-infectious, for instance, for people who use contact lens. The type of endophthalmitis consists of two. First is endogenous, which is related with systemic diseases, and the second is exogenous, which is related with trauma or surgery. If we saw this table, we see that the prevalence of fungal endophthalmitis is very low, around 8%, but even though it's low, it's important because it causes blindness. And the cause is yeast, candida, and the mold aspergillus and fusarium. Endophthalmitis endogenous, usually related with candida infection. It happens in severely ill patients with invasive candida infection, which can spread to the retina, to the eye, and ultimately
Application in nursing. Access the above mentioned signs and symptoms present by the patient: roughness of the conjunctiva, the screen, vision, yellow edema, and pain. And sometimes were most relaxed that we saw proved by the patient out, but for thus many has triggered. This condition shows a previous surgical intervention. If the secretion is above on ocular layer in perform, it is condition bother the elimination of secretion and the maintain the maximum success possible. Pros and cons. Pros. Fungal endophthalmitis, when diagnosed in time, can prevent many of the complications that entry and apply the appropriate treatment. Cause. The characteristic ophthalmologic insignis is the presence of great elevated polydermacoated lesion involving the chlorine and retina, located in the posterior pollen, which may be single or multiple, and if not tried in time, the danger is irreversible.
Routine OCT exam and the eye injection for her right eye. I typically alternate eyes. I don't typically do bilateral injections. And we did her ILE injection. Everything went well and smoothly. But she called our office 3 days later, and she said she has a dramatic decrease in her vision, and she's been complaining of this mild aching pain since the morning. So we immediately told her to come in. And this was her presentation, which came into the office. So her visual acuity had dropped down from 20/40 to about counting fingers in 1 foot. And she has this red, angry eye. You can see some corneal edema, haziness due to quite a bit of flare, and 4+ cell in the AC. And you can see a hypopyon developing. So this is kind of a classic presentation, kind of a nightmare scenario with a patient that's been doing really well and has a nice management plan, and then comes in with this complication. So diagnosis is usually at this stage is not too hard to make. It's the management that is kind of tricky. So when we think about diagnosis, number one and that comes up to mind is bacterial endophthalmitis. So endophthalmitis, just to touch base, is classified different methods.
Use applied in Ecuador. County is given using a free-line timing in fungal endophthalmitis, testing its local and systemic toxicity. The emergence of axole intifugas with lower radar oxide infection and the possible of oral administration have been present as an alternative. Some cases have been described on the therapy success Osborne Gasole in patients with fungal endophthalmitis. Fungal endophthalmitis is usually an idontal bilateral infection in 1/4 of cases, and the most common symptoms are brilliant vision and photophobia. Conclusion. Fungal endophthalmitis is a serious ophthalmology emerging and requires prompt initial attention due to the consequent in many entail. The work of the nursing, always in condition with the rest of the team, is extraordinary. Significant food in the correct administration of medicine, which requires special training and in the magazine on the psychiatric and psychological symptoms of the patient and her or her family. Thank you very much.